In primary care sports medicine, I take care of all muscle and joint problems, so anything from a sprain to a strain to a pulled muscle. But I also take care of other athletic injuries such as skin problems, concussions, head injuries. It's important to make sure that you see somebody who understands what the athlete is doing and the care that they need, because the treatment is really different, particularly for things like head injuries and concussions. And it's important that you see somebody who understands what the rules are, what the treatment protocols are, and the latest research. And in sports medicine, that's what we do.
My name is Ethan Horne. I go to Richlands High School, and this is my mom, Renee Horne. And I had a problem with MCL. I tore up playing football.
We were playing up at South Lenoir that night, kind of warm, muggy night, right in the middle of the season. He was in perfect physical condition, so it tells you it's something that can happen to anybody at any given point. It was early in the football game, probably his second or third carry of the night. Just running a toss to the outside, and he tried to cut back, and he went down. And the thing about Ethan is that he's a kid that never stays down.
And I was just sitting there thinking, well, he'll get up, because he always, before, would take a hit, hard hit, and get up. When he wasn't getting up off the field and the coaches started running out there, I realized it was more serious than what we originally had thought.
I was actually on my way back into town when I got the call that he had been hurt. He had taken a hit to his knee, causing his knee to bend sideways, and when that happens, the ligaments that are on the side of the knee can get injured. And so in his case, it was the ligaments on the inside of the knee, which is the MCL, that appeared to be torn.
Anyway, that was on Friday night. Dr. Playford told us to please be in his office first thing Monday morning. Hopefully the swelling would have been down and we could go ahead and get a scan of his knee to see exactly what was going on. Needless to say, it was a very long weekend, trying to deal with the injury and the pain, as well as the emotions that were running pretty high at that time.
It was devastating to me because it was my senior year of football, and it was only the third game of the season. I wasn't quite sure if I was going to be able to play football again or not, but I was more worried. I wouldn't say more worried, but baseball season, I didn't know if I was going to be able to play baseball, and that's more of what I was hoping to go to school for, to play baseball.
So with an injury like that, the most important thing initially is to try to elevate it, put some ice on it to help keep the swelling down, and then protect it. And so I had a brace that we put on his knee and put him on some crutches so that way he could keep his weight off of it. And then it's a matter of ice and rest initially. And that's as they said, the hardest part is trying to be patient and wait. But then once the swelling went down a little bit and we got the MRI, then we were able to tell exactly how much damage there was and what was torn. And luckily it was something that didn't require surgery. It was something that we were able to treat with brace and physical therapy and rehabilitation.
In my experience, I've done this a long time and dealt with a lot of physicians over the years, and there's so many physicians that these athletes go to that don't have the sports background that Dr. Playford and his staff are experienced with. He knows sports, he knows the types of injuries that these kids are dealing with, and he puts them on a plan that is what is in the best interest of these kids. They play sports because they want to play. They don't want to be sidelined by injuries, although Doc's not putting them back before they're ready. He cares about these kids. He knows them by name. He is there at any time we call him, so that if we need something or these kids need something, he is more than willing to drive over here to the school, take a look at the kid. And he's provided us a very unique opportunity that we have a very thorough and very educated physician on staff with us that gets these kids back on the field or on the court as quickly as humanly possible, but without sacrificing their well-being.
You know, that's the thing about high school. It's not a professional deal, so we care about the kids kind of outside of the sports. I mean, and Ethan took a hard hit, I think, emotionally during that time. Like I said, going to practice and being hurt is horrible. It's the worst thing on earth, and so seeing a kid go through that, especially when they're a senior. It's one thing when they're a freshman or sophomore and they get hurt, they've got another chance. When they're a senior, that's it. So, I mean, you get wrapped up in the guys because you care about them. And that's one thing Dr. Playford has. He cares about the kids.
He stayed positive with me the whole time and talked to me about it, which made me stay positive and had that hope to get back on the field, which I did.
The hardest part as it starts to feel better is you think it may be healed because you don't notice the pain anymore, but it's not, and so holding back is the hardest part. He tried to bribe his way back on the field a couple times.
Hey, gotta try.
The whole experience, it just went so smooth, the recovery. He communicated with the coaches, with the other physical therapists that were trying to mend him to get him back to compete. He ordered the necessary equipment that Ethan needed, whether it be crutches, all the different, he went through 3 different knee braces because of the process of the healing. There was different ones that he had to use, and Dr. Playford made sure he had those, and then when it was time for him to go back into the game, he ordered another knee brace to make sure it was legal for him to wear in our division, as well as strong enough to hold up, being that Ethan was running back, he could take some pretty nasty hits.
And the fact that we were able to put him back on that field, you know, and he was able to finish his career with a touchdown, which, you know, and it was a very, what we call Ethan run. I mean, he weaved all over the field, he made people miss, he broke tackles.
I was on the sideline for that game. That was a very cold night, so I remember that night, but yes, it was nice to see. It was satisfying for the trainer and myself because, you know, we're right there along with these kids, and that's part of the beauty of being able to work with the schools, work with the football teams, is being right there, and so we want him to do well too, as much as his parents do. So being able to see him get the ball and actually run in and make one more touchdown was gratifying for us as well.
I recommend him for a lot.
Highly, yeah.
Highly recommend him.
Yeah.
Because if it weren't for him, I might not have been able to play again. And he's great.